All right, it looks like we have a good number of participants joining us. So Dr. Griffin, thank you so very much for taking time out of your day today from seeing patients to join us for this CareConnect convo. This is sort of changing the way that we communicate at Kelsey-Seybold, doing everything via Zoom right now due to social distancing, but we really appreciate you joining us. So can you tell us a little bit about your background and how long you've been with Kelsey-Seybold?
Absolutely, and thank you for letting me join you. I appreciate it. So I am a dermatologist and dermatopathologist, meaning I both see patients in person as well as evaluate skin samples in the laboratory for Kelsey-Seybold. And I grew up here in Texas and did most of my training in Texas, but went to Minnesota to Mayo Clinic for residency and New York for a fellowship training in laboratory dermatology. And then I came back to Texas. So I've been with Kelsey-Seybold for, it was 2016. So this will be my 4th year here. Glad to be here. And I practice at the Tanglewood Clinic, see patients there for any skin condition, as well as do allergy tests for skin allergies, and then run the laboratory at that location.
Awesome, thank you. So I'm sure you've been getting a lot of questions from your patients about COVID-19, and I know that you're seeing patients virtually right now. Can you tell us a little bit about what a virtual visit looks like with dermatology at Kelsey-Seybold?
Absolutely. So we, at Kelsey-Seybold, we were poised to really make a quick transition to virtual visits. In fact, we've had the capability for some time and have integrated it into our practice for at least the past year, maybe a little bit longer than that. So when we decided to see patients predominantly virtually, what we did was we extended the opportunity to do that, not just to patients that had done it in the past, but any new patient, as well as patients that may not have had that accessible as part of their insurance plan in the past. So what it looks like as a patient is that you go online and request a visit or call through the call center, and they give you a choice to visit with any of the dermatologists that have availability. And we try and work through the app that integrates with our medical record called MyChart or MyKelsey Online. And as a patient, we do a face-to-face visit, just like you and I are talking right now. But it may be, in some cases, it's helpful for the patient to submit a photograph through their phone or through their computer if there's a particular place that they're concerned about on their skin. Because sometimes the video doesn't do skin justice, depending on the lighting and certain things. But as a patient, you get to speak face-to-face with me, just like you and I are talking right now, and we, as though you were right in front of me, we go through all of your history and work through what particular skin concern you have at this time, and we're able to formulate a diagnosis and a plan and send in prescriptions and do absolutely everything. And occasionally we have to bring you in person to get a better look if it's a little more complicated than we can do over the video. But most cases we're able to take care of right then, and we're even able to plan follow-up appropriately just through the video.
So you mentioned skin conditions. Lots of people have questions about wearing these wonderful masks that we're all wearing right now, including our employees, to help prevent the spread of COVID-19 and protect ourselves from any germs we may encounter. They're causing lots of dryness, irritations on skin, rashes in some cases from wearing them. Do you have any advice or solutions to help ease everyone into wearing masks at this time?
Absolutely. Thank you for that question. So as most people have realized, if they've been wearing a mask a lot, our skin is not really well suited to be covered nearly 24 hours a day. So the most common problems that we've been seeing are due to just the physical action of the mask on the skin. So for example, rubbing on the bridge of the nose, or if the elastic bands are rubbing behind the ears, rubbing on the skin or too tight. been seeing what can really truly be described as skin irritation. It's not from allergy, it's not from anything else, it's just from the physical pressure and rubbing of the mask on the skin. And that is something that can be challenging to deal with, particularly if it becomes severe. So it's better to try and prevent it. And there are several steps that you can take to try and prevent it. Now, what I didn't say is that there are some signs that you can see on your own skin that may be a clue that you're moving from that just irritation to something that's a little more severe. So if you notice that there's redness where the mask sits on your face, and the redness lasts after you've taken off the mask for more than about 30 minutes. So for example, if you take off the mask at home and then before you go to bed, you still see redness and a little line where the mask was sitting, that means that your skin has already been injured. So you need to do, in addition to the prevention, you need to do some treatment steps. But prevention is relatively simple. We ask that you wash your face once a day, at least with a non-harsh detergent. So most people do that already, but what I mean by harsh detergent is a traditional detergent or traditional soap. Ivory and Dial are examples of relatively harsh detergents, though. So what I recommend would be, for example, Dove bar soap or Cetaphil, great products to use that are gentle on the skin. And then I would recommend avoiding oil-based makeup products if you're wearing makeup, such as a foundation. And I would recommend after washing your face to apply a moisturizer in the morning, preferably not an ointment-based, one that has dimethicone. A good example is Van-Apply or Van-Cream that are available widely. Those set up a good barrier on your skin and really help prevent some of that ongoing irritation. And then lastly, if you do have those signs of the significant irritation, the redness, etc. Are we back there?
Yeah, we're back.
Okay. Okay. If you have that redness that doesn't go away, you may want to consider using a skin protectant. And those are available commercially. 3M makes a great product called Cavalon, and they're usually used in the medical field. But you can get them at the pharmacy without a prescription. You can get it on Amazon, for example, Walmart, and consistently rub or by the mask. And you do that about 5 minutes prior to putting on the mask. And that has been used in a variety of healthcare settings and has been shown to reduce some of the ongoing irritation.
So what about, you mentioned rashes. We've seen in social media and on the news that some of the new developments with COVID-19 included a skin rash on feet. What do we need to know about this? Is this a true symptom of COVID-19?
Great question. So as we learn more, we get to learn more about the symptoms. Some symptoms are rare and some are common. So a skin rash is listed as relatively common as a manifestation of COVID-19. It's not as common as fever and cough, but as we're learning more, we're seeing more and more patients that presented with some sort of rash. And some of them we're learning when we see them in constellation with the other symptoms can be relatively specific for the infection. So one of the more common rashes that we see is what we call an exanthem, which almost looks like measles-like rash. And that can be a manifestation of many, many different viral infections or even medication reactions. So it's not specific. It doesn't tell you definitely that that's the infection you're dealing with. But if you have that and other symptoms like cough and fever or shortness of breath, then it is concerning that that may be what's going on. Now, there are some rashes that seem to be more specific, meaning they're more highly correlated with COVID infection. The one that you mentioned, a rash on the feet, has been seen in patients that may otherwise be asymptomatic. So it could be a good clue that you have an infection with COVID-19. And the specific manifestations are that on your toes, usually the tops of the toes, or involving just the part that's furthest away from your foot, the skin turns a little bit purple. It may be a little itchy or stingy or painful. And in some patients, we've even seen small blisters form. And that is not a very common rash. So there are only a few things that we've noted to cause that, and COVID-19 infection is one of those. So it could certainly be a clue that that's what you're dealing with. I'd like to bring up one other that we've seen, also not very common, but it's almost looks like the chickenpox. So COVID-19 is very distinct from the chickenpox virus, but we have seen patients that have presented with almost small little blisters all over the body, predominantly on the trunk, in the setting of having other symptoms, usually cough and fever. And those patients, it seems that it is a manifestation of COVID-19.
So let's jump a little bit from, we talked about rashes appearing on feet, to hands. The CDC has continuously come out and said that hand washing is the #1 thing we can do to protect ourselves and prevent the spread of coronavirus. We know that washing your hands continuously, using hand sanitizer, especially alcohol-based hand sanitizer, dries out your hands. Can this lead to eczema or other skin issues? And is there anything you can use or do to protect your hands at this time as well?
Great question. And you are absolutely right. Doing these things, though they are necessary and helpful to protect us from the infection, they do cause irritation on the skin. And it's what we call an irritant dermatitis, simply because the normal oils that your skin has that allow it to stay nice and pliable are continuously being removed by the soap or hand sanitizer. And that just sets up an opportunity for dry skin to set in. And it's uncommon that we see this as a manifestation of an allergy. It's usually just the physical irritation that goes along with washing your hands multiple times throughout the day. And there are some things that we can do to prevent it, and even if you acquire it, to treat it. So certainly an ounce of prevention is worth a pound of cure, and I'd recommend that everybody, after using a soap-based hand sanitizer, that you apply a moisturizer. And it doesn't have to be heavy or thick. Vanicream or Cetaphil are good examples of a light moisturizer that doesn't leave a heavy cream feeling after it soaks in. And the simple act of using that after you wash your hands can help prevent the dermatitis. Now, if you have the dermatitis, which usually appears most frequently between the fingers, that's where we see it, on the tops of the hand. It's not as common to happen on the palm, so it's usually on the top of the hand, between the fingers, and it looks dry, it looks irritated, it's itchy, and occasionally has tiny little fluid-filled, almost what look like blisters. If that is you, then you need to again, avoid those harsh detergents. So avoid traditional soaps like Dial or Irish Spring, and instead use the synthetic detergents like Dove or Cetaphil soap. And do the moisturizer every time you wash your hands. And then I'd also recommend using an over-the-counter cortisone product applied to the rash. And usually that'll take care of it. If it doesn't, then it may be worthwhile for you to visit with one of our doctors to talk about some more intensive treatments and to make sure that that's the cause of the rash.
So is there anything that our patients can do? If, let's say, someone has eczema and it's flaring up right now, is there anything they can do at home to help soothe the irritation from that?
Great question. Yes. So it's interesting that you bring that up because when we're all sequestered away and a little bit stressed out, it can bring out some underlying skin conditions. And eczema is one that loves to what we call flare when your body and your skin is stressed. So there are some things that you can do. If you're one that tends to get eczema, and what that looks like is itchy red rash and patches on the skin. So many times we see it on the arms in the creases or behind the knees in the creases. If that's the case, recommend that you, after you bathe, you apply a moisturizer directly to those areas. And you can even do something we call the wet wrap. And the wet wrap sounds a little silly, but it does a great job. So if those areas aren't responding just to moisturizer, then you can apply the moisturizer and then put a wet hand towel over the area, just one that's moist, not dripping, and let it sit for about 30 minutes. And it can really let the moisturizer soak in. Or if you can tolerate it, you can put some plain old Vaseline on there. Even though plain old Vaseline has been around forever, it still does a great job as a skin protectant.
So would you put the Vaseline on top of the moisturizer or cream, or just use the Vaseline alone?
You could just use the Vaseline alone. Unfortunately, that's not great if you're about to go out on the town, but I'm guessing not too many people are going out on the town right now because it can be a little goopy sticky. But for example, before bed, if you put it on an hour before bed, it has time to really soak in and can do a great job.
So you mentioned eczema can be tied to stress. Are there other skin conditions that are tied to stress that can flare up? I guess if you were to look at a patient, how would you know that someone has stressed skin?
Great question. So two parts to that question. First, stressed skin is easily irritable is part of how that works. And there's a lot of factors that can play into that. If you're not well hydrated, and one way you can check is if you pull up the skin on the back of your hand, it should spring back nicely. And if it doesn't, it may be an indicator that you aren't well hydrated, and that's just drinking nice plain old water. But then easily irritated skin is not well hydrated and becomes dry and flaky. So that's a clue that you may have stressed skin. And there are several skin conditions that characteristically are flared or made worse by stress. And in this case, it could be stress, like you're feeling stressed out because you're worried, or it could be physical stress. So for example, when we see patients that have the flu and their body is stressed, then that can cause a flare of their skin condition. So there are many different ways that your body can be telling you that you're stressed. And the characteristic skin conditions that get worse around that time are psoriasis, eczema, and something called seborrheic dermatitis. Seborrheic dermatitis is more commonly known as dandruff. And most people think of that as happening in the scalp with flaking and itching in the scalp. But interestingly, it can happen just about anywhere on your body. We see it very commonly on the eyebrows, on the center part of the face, around the nose. In patients with facial hair, they can have it there, or behind the ears, you can have itching, flaking, or irritation. And then some people even get it on the chest. And that may be something that worsens when your body is stressed.
So we had a question that came in. Part of the question was about dandruff, but the other part was about chapped lips. Why are lips getting so chapped right now? Nothing's really helping. What can you do at this point?
Good question. So that may be one indicator that you're a little stressed. Again, staying hydrated. But what we see very commonly is sun playing a role in chapped lips. I personally have seen a lot more people outdoors recently than normal. Not necessarily visiting stores, but going on a walk and getting a little bit of extra sun. You can get a sunburn on your lip. You may not think about it, but we see it all the time. And that is most frequently on the lower lip as opposed to the upper lip. So if that's where you're noticing the prominent chapped feeling or sensation, then that could be part of the problem. So I'd recommend chapstick or a lip balm that has a sunscreen in it that you wear on a daily basis. Plain old Vaseline does a great job with chapped lips. And interestingly, you know, we use the word dermatitis when it's itchy, irritated, peeling skin. And we use a different word when it's on your lips because we like to sound fancy. We call it chylitis. Chylitis just means itchy, irritated, peeling lips. And similar to your skin, there's lots of potential causes. And just plain old irritation is the most common one that we see. But you can have allergy there too. There's lots of potential causes for a continuously damp lip.
We have a lot of questions coming in related to skincare routines. What type of skincare routine do you recommend as a basic skincare routine for everyone?
So here's where it gets a little challenging. We're all unique. So everybody needs a little something different. There are some basics that apply to everybody, but each individual may have a little twist to what works best for them. When we get down to the basics, need to wash your skin with soap and water at least once a day. Doesn't have to be more than that. In fact, more can cause more irritation. And then for skin that is going to be exposed to the sun, so here in Houston, just living in Houston is a risk factor for sunburn and skin cancer. So there's a lot of sun. So need to use at least a SPF 30 sunscreen on a daily basis, preferably to the face, upper chest, tops of the hands, backs of the neck, and back of the ears. And those that can help prevent long-term damage. Then I would recommend, particularly if you're someone that tends to have dry skin or has a personal or a family history of eczema, to use a moisturizer on a daily basis. And luckily for you, a lot of moisturizers come with sunscreen. So you can double up on that and just apply one product and get the job done in a shorter time.
So we're getting a lot of other questions that come in about skincare. I know products are probably a hot topic, but specifically, we've had a few questions come in about breakouts due to wearing masks. What can you do to clear that up and prevent future breakouts?
Great question. Yes, anytime your skin is what we call occluded, meaning covered for a prolonged period of time, it can predispose to having acne or breakout. And that is most common with a mask. It's going to be common on the face, but we see it in other people that wear tight-fitting clothing at work, for example, or they have to wear a strap on their shoulder where they're carrying a backpack, for example. And it can be difficult to prevent because anytime you have constant friction in an area, it is going to predispose to that reaction. There are some over-the-counter products that can do a good job with preventing clogged pores. So that, in conjunction with trying to avoid prolonged covering of a particular area, can be helpful. I know that's tough when we're wearing masks a lot, but the particular products either contain something called salicylic acid, which is an alpha hydroxy acid, or benzoyl peroxide. Those are the two key ingredients, and they're both available over the counter. No prescription is required, and there are many different brands that have those ingredients in them. But those ingredients help naturally break down the skin cells that may be plugging the hair follicles or the pores in those areas. And most of the products come as a wash, so as a face wash, for example, that you could use at night. And really the big thing to look out for is too much irritation, because those products, though they do a good job breaking down skin cells, they can also be a little irritating. So kind of working them into your routine, not overdoing it. So maybe using it every other day for a week or two until your body has gotten used to it and you know what you can tolerate. And then remembering to do the moisturizer. And I would put a note on the moisturizer when purchasing one, because there are so many to choose from. there is a key word that's important to look for, that and with sunscreen products. And it's a funny word, one of these medical lingo, medical jargons that's out there. It's called non-comedogenic. And that just means it does not plug pores. And it should be listed on the product information. A good example of a non-comedogenic moisturizer is either Vaseline or Cetaphil. And both of those come with sunscreen if you'd like. So those will not predispose you to having a breakout when you use them.
If you are having breakouts due to your mask, do you need to be concerned about having acne spots or dark spots on your face from having these breakouts?
Good question. So that is something that can happen, particularly if you have a really severe breakout and people that tend to have a darker skin tone. You could be left with little dark spots that come up after the breakout. So really avoidance is key there. There's not, there are some treatments available. In fact, there are some that are available over the counter. Have to think of the particular percentage, but most of them, at least the ones that work well, are prescription. So if that describes you, if you tend to have the dark spots that come up after a breakout, really getting on top of it ASAP is the first way to prevent leaving the dark spots. And then number two, you may want to consult with your physician to talk about some of the more effective products to prevent the dark spots, because those can really take a long time to go away.
So we mentioned sunscreen being key as a vital part of our skincare routine and making sure that we look for a sunscreen that doesn't clog pores. Is there a specific SPF we should be looking for, being that we're in Houston and we have a lot of sun for most of the year?
Yep, great question. So the official recommendation is at least SPF 30. For a long time, we were told that anything above that doesn't really make a big difference. And in the science world, if you use it exactly as it says on the back of the bottle, and it's applied in the precise amounts that they recommend, that may be true. But in the real world, the way that we use sunscreen, it is rare that somebody uses enough sunscreen. So SPF 30 may go down to like SPF 10 just because you didn't use enough. So using a product that has a higher SPF does have potential benefit. SPF 30 is the official recommendation, but for my patients, I recommend SPF 45 or higher.
And does that recommendation change for children? We have a question that came in about kids being home and being outside as well. And how do you apply sunscreen to children?
Great question. The number is the same. Number's the same, child or adult. Then the actual type of sunscreen does differ based on the age of the person. So for little bitty babies, we usually recommend a mineral or physical sunscreen. Zinc or titanium dioxide are the most common ones. And a lot of those products are marketed for babies. So Neutrogena baby, those products will contain the physical sunscreens. Those are not absorbed. They're not as cosmetically pleasing, meaning they may leave a white residue after you apply it. But the little bitty kids don't mind. And then of course, combining that with some sort of either clothing or a hat or a shade structure can be helpful for the really little kiddos. For the ones that are running around, while physical sunscreens are still appropriate, you may be better off using something that is more easily applied, because getting them to participate in applying the sunscreen can be a little more challenging. So in my family, we use a combination. For our kiddos, we use a spray on their body. And then for the face, we'll use a physical blocker. And we get them involved in the process. So they get to, we usually use the stick where they get to rub it on the skin and just make sure we're not getting it in the eyes. And then I apply the spray to the rest of their body. And then don't forget to reapply, because sunscreen, even the longer lasting ones, really wear off after the between an hour and an hour and a half. So if you're going to be outside at the beach, at the pool, or running around all day, you do need to reapply because it wears off.
Thank you. Well, do you have any other tips or advice about skincare with everyone being home right now that you'd like to share?
Great question. So as far as just the routine things that we need to do right now, the biggest thing is washing your hands. I mean, even though a lot of people don't consider that part of routine skincare, we can't forget to do it. And you really need to do that anytime you're coming back from visiting outside or visiting friends. And that's going to make a big, big difference. And, you know, they always used to say to prevent breakouts, don't touch your face. Well, this is another time of life when we get to not touch our face because we're trying to avoid the spread of the virus. So that can be another reminder for you. Don't touch your face. And that's really just to avoid, for breakouts, to avoid putting oil from your hands on your face. And then, of course, if your hands aren't clean and they could be contaminated, it's to avoid putting those things on your face as well.
Well, thank you. I know you have to get back to your patients, so we're going to go ahead and wrap this conversation up. We do have a few other questions that came in at the end. I'll touch base with Dr. Griffin offline and we'll get those questions answered. If you signed up for today's CareConnect Convo via Zoom, we'll send those Q&As out to you for the questions that were submitted that we didn't get a chance to answer. And if you have any other questions, please feel free to reach out to our contact center. You can book a virtual visit with Dr. Griffin. The number you can call for that is 713-442-0000. And if you have any other questions about COVID-19 or any testing of COVID-19, Kelsey-Seybold has the most up-to-date information on our webpage at Kelsey-Seybold.com. So thanks again to everyone who joined us, and we hope you'll tune in for our next CareConnect conversation last week. So have a great afternoon, everyone.
Thank you.